It has been nearly a year since the April fire that brought one of Johannesburg's most important hospitals to its knees. Now the health minister is stepping in to keep an eye on the repair work at Charlotte Maxeke Hospital. Minister Joe Phaahla toured the hospital today, trying to assess just how ready the hospital is to fully reopen. You'll know that the fire last April caused the evacuation of hundreds of patients, and of course it destroyed millions of rands worth of medical equipment and infrastructure at the hospital. And for more on this, eNCA reporter Pule Letshwiti-Jones joins us now. Hello, Pule. So there's been a meeting, I understand, underway since 11 o'clock this morning. Tell us who's in that meeting, and is the meeting still ongoing at this point?
Yes, Sally, there was a meeting between the Health Minister, Joe Phaahla, and of course the MEC for Health in Gauteng, Nomathemba Mogoeti, and other officials as well regarding what would be a way as to paving the process of going forward as to how some of the the units that were gutted by the fire, including the mental health wing and of course the infectious disease ward as well, would then be repaired, and as to speed up the process of ensuring that patients don't have to be, piling up on the waiting list, and that there can be some bit of normality as well. This meeting has been going on since around 11:15 today, and what we do understand that it just adjourned a couple of minutes from now. Quite disappointing that the minister was actually paved into his car and was not given the chance to actually speak to the media, and that speaks to like a lack of transparency, one would call it, Sally. And while that's the case as well, there are still questions that were supposed to be posed as to when some of these units will be open, when patients would be gotten to, and what would be the way forward. That's not the only issue. The other item that was on the list as well was the issue of the Chris Hani Baragwanath Hospital as well, which we do understand that has been facing allegations of food shortage. Also there, no clarity as to what would be the way forward. So it was really quite disappointing to know that, the media has been standing outside in the call for this while, and we haven't received any feedback from the health officials.
Yeah, that is rather dismaying, and it possibly suggests there's no good news to tell you. Hopefully we will get word soon, and the health department will issue some sort of release. But it is such a crucial issue because, of course, as we know, since the Charlotte Maxeke fire, patients who would normally go to that really big central Johannesburg hospital have had to go to Chris Hani and other surrounding hospitals, putting enormous pressure on those hospitals. While you were waiting outside for this meeting to end, have you been able to get a sense from anyone at the hospital on whether the promises made, in fact, I think just a few weeks ago when there was another big delegation visit to the hospital, are actually making much progress with the repairs?
There seems to be some sort of, a sense that the media has been barred to getting closer, to getting answers as to what is the way forward. From what we understand as well, we were told from the beginning that we would not be able to participate in the tour around the hospitals to try and see what has been the progress. And that was quite problematic once again, speaking to the point of transparency. But what we do understand is that there's also been issues around the financial management around the health department, especially in Gauteng, where we're seeing that there's been complaints and allegations made by contractors who were then disturbing the supply chain, whereby food cannot be delivered to some of these hospitals. And what we saw as well was it was quiet today when you got here, but the delegation was locked in this meeting for quite some time, and the security was beefed up, so you couldn't get close to the message to try and understand what was going on. And while the media liaison officer close to the health department kept on saying that we would get the opportunity, when we actually blinked and opened our eyes, the health officials were actually nowhere to be seen. And I think the communication there was actually broken down. The coordination was quite poor, and to have us stand here until 11 a.m. was quite problematic, which also blocked us from getting the answers as to what is the way forward, what is the minister going to be doing from here onwards, how will the budget be repatriated to some of these hospitals to ensure that patients are helped, that they're not on the waiting lists, when will these units be reopened, and what is the action as to what we've heard about some of the workers who've resigned from Charlotte Maxeke Hospital due to these issues, the contractual issues, the issues of low staff morale. And those are just the questions that we thought we could have gotten answers to, but to no avail. We're still stuck here waiting for answers.
And Pule, of course, on today, Human Rights Day, which is there to not only remind us of the Sharpeville massacre of 1960, but also how far we are supposedly have come with our Bill of Rights, enshrining, among other rights, the right to proper health care. And when a hospital is closed for nearly a year because of a fire, and patients cannot get the treatment they need and are left waiting and waiting for important life-saving treatments. It is quite an indictment, it seems, on the health department that they haven't even given firm timelines. Do we have any idea on when these repairs are meant to be fully done?
Well, what we understand is that these repairs were supposed to be done as soon as possible. One would also think that the officials, especially in Gauteng, are waiting for the financial year to kick in. We do understand that the Baragwanath Hospital, gets around 3 billion of its budget, which will serve then to some of the services that are happening within the hospital. But there hasn't been quite clear timelines as to when some of these units would be open, putting a strain on the waiting list. And like you've said, around the neighboring hospitals where then patients are been advised to be taken to, and those are just some of the time frames that are expected to be given by the health officials. But for now, there hasn't been any clear indication as to what will be the way forward and when some of these units that were gutted by the fires will be ready to open. The minister is still yet to go for another inspection. Before then, we can be getting advice as to what will be the way forward. The health department did say that they will be releasing a statement later on in the evening today. We're still waiting for that to see what is the plan going forward from there.
All right. So, Pule Letshwiti-Jones, I'm sure you'll let us know as soon as that statement comes through after that long meeting at Charlotte Maxeke Hospital, but no official word on how it went. So we've just brought you two stories that actually deal with government's failure to deliver basic human rights. That